what I would like to do is introduce you to our listeners,
Okay.
and that way they'll have a little bit of knowledge on your background. And I'm going to start by just kind of briefly going through your bio. So this is Dr. Robert Ullman. He is a homeopathic doctor, and his bio says he is licensed as a board-certified naturopathic physician specializing in homeopathy, received his naturopathic degree from the National College of Naturopathic Medicine in 1981, graduated from Ursinus College in Pennsylvania.
That's Ursinus.
Ursinus.
Right.
In Pennsylvania with a degree in biology in 1973, and from Kansas Newman College with a degree in human biology in 1979 as part of his naturopathic training, and received his master's program in mental health research, or attended a master's program in mental health research for 2 years at Bucknell University from 1973 to 1975. That's interesting. Dr. Ullman is also the author of 7 books on homeopathy with his wife, Judith Reichenberg Ullman. And they include, I'll just give a couple of the titles, Homeopathy, on homeopathy, including the best-selling Ritalin-Free Kids, The Homeopathic Treatment of Depression, Anxiety, Bipolar Disorder, and Other Mental and Emotional Problems, previously Prozac-free, and A Drug-Free Approach to Asperger's Syndrome and Autism, Rage-Free Kids. And this is where I want to come in. Dr. Ullman is practicing out of Washington State, but as many people aren't really familiar, many of our listeners are not familiar with homeopathy at all. So I would love for you to give just some general background. I know you do classical homeopathy. It states here if you could kind of mention a little bit more about that, and that it's wonderful that this can be done via a phone call or a Skype interview, because some people might live thousands of miles away from you and they can't get to you, but you're able to do appointments from a distant location. And particularly in autism, can you give us a little bit of background, and we'll get some more specifics, but just give us some general background on what you've worked with and what kinds of things that you've seen, and I'm just going to let you take it from here right now.
Okay. So as far as homeopathy goes, there are various forms of homeopathy, but what I practice is classical homeopathy, and with an emphasis on the sensation method of Rajan Sankaran, which is a more, perhaps a little more avant-garde approach than traditional classic homeopathy, but is very effective. So I've been doing this including school since about 1980, and so I've been doing it for quite some years, and over the years, I'd say particularly since we published Ritalin-Free Kids, I've specialized more and more in the treatment of children and adults with ADHD and autism and other behavior and learning problems. And I found that is very amenable to homeopathic treatment, that those kinds of conditions can often be improved. There are limits, depending, for example, in autism, where the child is so profoundly impacted by whatever it was that made them autistic in the first place, that it's, for some of the ones that are very, very profoundly impacted or disturbed, it's difficult to move them a long way past that, but you can certainly make gains and improve their speech, improve their understanding, definitely to just help with any health problems they may have. And so I never know until I've treated somebody exactly, what the prognosis is, how much can be helped with homeopathy, and some things that may never move with homeopathy. So, but the object in homeopathic treatment is to find the one substance in nature that most resembles, the effects of which most resemble the condition that's being treated. And so, you're looking for a substance in nature that's possible of creating symptoms that are similar to what the patient has. And if you make that match exactly, you will get definite changes in their health and well-being. And some of those can be profound changes. Some of them may be minor changes. There are various levels of homeopathy that can be done. For instance, you can do constitutional or chronic homeopathy, which is mostly what I do, but you can also treat minor illnesses with homeopathy. You can treat colds and flus and earaches, and we have a whole book based on this called Homeopathic Self-Care, that with a kit of 30 remedies, you can make significant impacts in your own health care when you have an acute illness. And that, so we found that book and the general methods in homeopathic self-care are very useful for families who have a screaming kid in the middle of the night and don't know what to do about it. And if they can find usually in each condition we give the 5 most common homeopathic remedies for that condition, like earache. And so they might have chamomile or pulsatilla as the top 2 remedies. And if you can match the symptoms as they're described for each remedy with the person who's having it, sometimes it's difficult with screaming kids because they're not telling you very much, but at least if you can observe what's happening, how they're upset, whether they're like shrieking at the top of their lungs or they're just sort of gently weeping, you might be able to differentiate between chamomilla and pulsatilla. And so, and if you can make that determination, you can give that remedy, and very rapidly that situation will change, and usually entirely for the better. And so the screaming goes away, the weeping goes away, the pain gets better of the earache. And so, and there are many, many different acute illnesses that can be treated with homeopathy. And so it's kind of the first line of defense for parents with children, you know, and well before having to take them either to the pediatrician or the hospital. And so there are those 2 levels. There are things that you can do yourself in homeopathy because you can just look at the common symptoms for a particular illness, a minor illness, and then you can match the symptoms that your child or yourself have. And if you match them well enough and you take doses of that remedy, usually maybe 2 or 3 times a day in lower potency like 12C or 30C, then you'll see changes in that health condition. But for chronic illness, it's more of an extensive interview that now with children who are nonverbal, obviously I'm interviewing their parents, but children who can participate, at least to show me a little bit of how they are and what they like and what they don't like, and anything that they notice about their own health and mental state, that's all very helpful. And then the parents will fill in the history of the illnesses the child has had and the kind of behaviors that they're exhibiting now, and it's up to me to figure out where that falls in various diagnostic categories. But what's most important for me is not the diagnostic category per se, but the actual symptoms that the child's experiencing. And when you can notice what those symptoms are, then and you can verify that by what the parents describe and find the whole picture of symptoms. There are various ways we can analyze that. Sometimes we know the remedy so well that it's very easy. We just hear the case and we know the remedy. But in other cases, it's more difficult to know. And so one of the ways that we've learn to analyze the data, you might say, what information we get from the parents and the child, is to understand the kingdoms of nature and how people fall, their remedy picture falls within those kingdoms of nature. And so, for instance, the 3 most common are plants, animals, and minerals. And so this is something that came along with Dr. Sankaran's approach. It was known back in the 1800s to divide it this way by a homeopath named Farrington, but at that time it never quite caught on as a method of doing things. But we found it tremendously helpful, since we learned this in the early 90s, to just look at the different characteristics of the person and of the child, and to find out, do they resemble in general the nature of plants, animals, or minerals. And so the differences of those groups, the plants are very sensitive. You know, if you just think about plants, well, they're rooted, and they're not going anywhere. And so they pretty much have to sit there and take it. Whatever the weather is, whatever comes along to eat them, you know, they're not going anywhere. So they're hoping for good conditions and lots of water and lots of sunlight, and they can flourish in that way. But also they may develop defenses, you know, against animals, for instance, like being bitter or being poisonous, or things that would keep them from being eaten. Or they might develop the bark, like of trees, that's something hard and difficult to bite through. And so plants have their way of trying to defend themselves, particularly from animals and from the weather. And so their issue in plants is sensitivity, because they're sensitive to the different weather conditions. Too much sun can kill them, too much rain can kill them, and float them away. They can be subject to freezing and melting, all those environmental conditions. And so they have learned to adapt within a range of sensitivity. But you'll find in each plant family there's a certain kind of sensitivity that you can see is typical of that family. And one of the first ones that was recognized was the family of the same ones as in the remedy arnica. I'm trying to think of the family now. This is and I'm blanking on it. But anyway, it is the remedy like arnica, bellis perennis, and they have all to do with injury. And so so each of those remedies has its own way of having injury symptoms. Like arnica, for example, is bruising. Bellis perennis is injury to injury to veins. That's the English daisy. And so all of those are members of the daisy family, and the Asteraceae they're called. And each of them has its own way of relating to injury or being sensitive to injury. So when you see that the primary issue in the case is injury, then you go to that group, and you can figure out by knowing the particular way that plant perceives injury, or people who need that plant as a remedy, how they perceive injury, then you can pick the correct remedy in the group. Animals, for example, have things like fighting, you know, for survival. That's the biggest thing in animals, is to fight for survival. And they're either tending to be predator or prey. And so the prey animals to be scared and weaker and hiding. The predator animals are fiercer and are going after the prey animals. And so, and that may be anything from snakes to birds, you know, that are preying animals, or classic prey animals tend to be things like rodents or other smaller snakes, perhaps, that will be killed by larger predators. And lizards, for example, are also in the reptile group. So within animals, you have reptiles, you have mammals, you have birds. And so each of those have their own characteristics. And in the minerals are about security and attack and defense. And so they are more about structure. They're about how things are structured. And so they are more, you might say, practical. Their issues are practical. How do I do something? How do I build something? How do I learn something? And those those kind of traits are typical of minerals, and they're looking for security. They're looking for their home to be safe. Sometimes they're looking for creativity. They like creativity. Sometimes they have issues of responsibility. And sometimes they just have workaday issues like, how do I get things done? But they're different from plants who are sitting there and taking it, and animals who are going after everything and trying to eat it. So all of those different groups, will help to lead you to what remedy a person needs. And Karen, I was just wanting to make sure you could hear me and I could hear you.
Yeah, in respect to children with autism, I'm wondering when you talk about animals who are in the fighting. So this might be a child who has more of the rage issues.
Exactly. Yeah.
So this is what you're talking about, yes?
So sure. And although you might have also, say in autism, you may also have fear, where the primary thing is not rage, or you may have a combination of fear and rage, as you might see in one of the Solanaceae or the Belladonna group, where they have both fear and rage in the plants. They're probably the plant group that's bordering on animal issues. And so, but in pure animal remedies, like for instance scorpion, scorpions will as soon kill you as look at you. And so if you have a child who is incredibly violent, and without remorse, without any, just will, attack anybody anytime for no particular reason, that's in that group of very violent animals like snakes and scorpions. So
by hearing from the parents the types of issues that are going on with their child, depending if their child might be 3, 7, 20,
right,
they can all just be, you just focus in on the specific characteristics of what's going on, and it doesn't matter the level where they are on the spectrum. Everybody's different. It's going to affect them differently, and your outcome is different. Can you also give us some examples of the successes that you've seen, the percentages of, and to what extent at different ages and different levels on the spectrum?
Sure. The more, whatever has impacted that child and made them autistic, and there's a wide variety of opinions as to what could possibly do that. But it's so the more impacted they are to begin with, the less bright the prognosis. Although I can be surprised at times, that if I can key onto the exact remedy and they will take it for a period of time, they can make substantial gains. But when I see somebody who's nonverbal and not very responsive and not able to learn anything, that's going to be a much harder case over time than a kid with Asperger who's talking and his main problem is that he can't get social cues. There's a whole range in between there.
Exactly. But even with the kids who are pretty extreme, have you seen very surprising?
Especially the behavioral. Where it's not that they're totally not able to function, but they're able to function, but they have significant emotional imbalances. Homeopathy really works well in those cases.
And what? Go ahead.
Oh, just that more so than you. I mean, you could see the same thing in a child who was, severely impacted, when they were very small, perhaps by vaccination, who knows, but, or by just genetics sometimes. There are cases where you see children who are autistic essentially from birth. They never really come out of that. And that, although even, to wade into the vaccination controversy, some of those kids are getting multiple vaccinations at birth now. And so
Exactly.
that's a difficult issue to settle out.
It is. There's a lot of mercury. In fact, I was at an event last night with Bobby Kennedy
Mm,
on mercury, and so when thimerosal,
yeah.
mercury, aluminum, various toxins have entered the system at a very early age and have affected the brain, and are still toxic in the system. Of course, my book is Natural Healing Autism.
Hmm.
It's about clearing that heavy metal detoxification and brain
Right.
support and
Sure.
repair. And my own son he was diagnosed on the autism spectrum, and through what I did with him, he's great. And almost all of his symptoms are completely gone. And homeopathy was a big piece of
Hmm.
that. We had great success with it. So, in somebody who has been affected by, we'll say, environmental toxins, what what do you feel is the ability to how would I say, uh, sort of balance the brain back out and get those affecting what the toxins have done.
Right. So first you have to, I mean, from the homeopathic point of view, because I'm going to talk from that point of view,
Yeah.
is you have to see, okay, so what symptoms have those toxins caused that are different from normal development?
Hmm.
What's
Right.
been altered? What's not developing as it should be? And how is that manifesting? Is that manifesting in the emotional level, on the physical level, on the mental level, on all levels? It's the more levels it's happening on, the harder it is necessarily to be able to understand the whole picture. But if the symptoms are clear and strong, you can usually find the case better. You can find the remedy for the case better than if they're very vague. If
Hmm.
there's not much that you can differentiate from one child to another, and if you can't do that level of differentiation, it's hard to find a homeopathic
Hmm.
remedy. Now,
Because
partly that can happen because the child's nonverbal, for one thing, and so they can't tell you a thing about what is actually going on inside. So it is like treating babies. You can only look at, okay, so what's the stimulus response going on, in this
Hmm.
particular child, and how severely have they been impacted, and what are the symptoms that are showing? Are they upset about certain things? Do they crave certain things? Do they
Hmm.
um,
Right.
do they hate certain environments? Do they have trouble with one parent and not another parent? You just look for whatever it is. Whatever, it's like clues. You need clues to. And so in homeopathy per se, you don't necessarily have to know exactly what happened um, or what substance impacted that person, but you have to see the pattern of how it impacted them and what symptoms were created as a result. And if you can get a very good picture of those symptoms and the progression of those symptoms, or how they started, or a situation where the child was fine one day and terrible the next, and what happened, what was involved, and and what symptoms were created at that time. And so,
They're-
you know,
So a lot of these are affected in utero
they may
via
be,
toxins introduced to the mother as
right?
well,
That can
and
often
maybe
be.
their system
And,
can't take more.
and so one of the things that we often look at in children's cases is the history of the mother during pregnancy. What,
Hmm.
what emotions did she have during pregnancy that were different from her normal emotions? What were any things that happened to her, and to a lesser extent the father, but particularly to the mother during pregnancy? And what were the dreams she had that she never had when she wasn't pregnant? What were the emotional states that she went through that were never there before she was pregnant? And sometimes you'll find that some of that, or even all of that, relates directly to how the child is now. And so if you can find out the mother's state during pregnancy, it can often give you clues as to what territory you're in and where to look for the remedy. And so,
Hmm.
but not always, especially in situations where whatever impacted the child happened after birth. It wasn't at birth. There was some other insult later on. And then that's the mother's history in pregnancy only will yield, okay, so what was the ground that you started with? And then what's changed since then? And in that sense, sometimes you're looking to take the child back to where they started from, back more toward the better state that they were in before they were impacted by whatever it was. And, yeah.
So if a parent was feeling like, regardless, basically, we're saying, of the situations, I know you deal with autism, ADD, depression, anxiety.
Right.
There are a lot of things that are in the system, but then there are a lot of environmental impacts as well. So you're feeling that you've seen homeopathy has been very beneficial in your practice with children on the autism spectrum.
Yes.
For various levels, depending on how severe or mild they are on the spectrum at whatever age.
Right.
Is that right?
Yes.
Okay.
Yeah.
Excellent. And could you give a website and contact information if a parent wanted to contact you?
Oh, sure. It's very simple. Our website is www.healthyhomeopathy.com. Great.
And that they would contact you via the website?
That's easy. We have a phone number for our office, which is 425-774-5599.
Okay, excellent. And do you have any other any other thoughts or information that you feel would be beneficial for our parents right now?
Well, I think that it's important not to give up hope. Not to accept whatever diagnosis you've been given as impossible to change, because many of those diagnoses are possible to change, and many of them can be brought along either gradually or quickly, depending on the situation. But I would suggest not necessarily just accepting whatever someone tells you after whatever incident it was that ruined your child, to
that's it. That's going
to be it forever, because I don't believe that's necessarily so. There are many different therapies that can be helpful. There's neurofeedback, there's tomatis, there's homeopathy. Very clearly can be helpful. Nutritional therapy can be helpful. Helping the gut flora can be helpful. GFCF can be helpful, gluten-free and casein-free in half of autistic kids. So many things, looking at allergies and sensitivities can all be helpful. They're not all things that I do. They're all disciplines in and of themselves, but they're things that I recommend when I think that's a place to go. That you should.
I also noticed that you do energy healing work.
I do.
And you have one book that's even endorsed by the Dalai Lama.
Yeah. This was a book of stories of enlightenment. So we collected stories of people's moment of enlightenment, and so we applied to the Dalai Lama to see if he would write a foreword.
Oh, very nice.
Yeah, and he came through at the very last minute. Really, it was midnight on the day of that we had to turn in the manuscript the next day.
Okay. I watched the movie. Have you seen the movie Horse Boy, about the child on the autism spectrum, and his parents take him to, I believe it was Tibet, to work with a shaman and things like that.
Yeah.
So do you do energy work with these children as well?
I do sometimes. Mostly I'm working at a distance, and so, but when I'm in my office in Edmonds, I will do that with children I think would be amenable to it, and parents who are open to that kind of treatment. I was trained in matrix energetics, if you've ever heard of that.
I do. I know Richard. I have gone to his seminars as well.
Right, and so I use things from that, and also the Bowen technique, which I learned quite some years ago, maybe 20 years ago. So.
Great. Well, We really appreciate you coming here today. I know if I had pictures of, I wish I almost had a video of my son back when he
Oh,
was
yeah.
his worst state and show people what he's like now. He wasn't diagnosed till he was almost 10, but this was
Wow.
back in the early 2000s when, it really wasn't, the awareness wasn't as great. But, of course, all the therapists told us we just need to be firmer with discipline. It was us. And so I knew something was up, and I worked really hard. I've been in the holistic health field for almost 30 years, and
Hmm.
when he was diagnosed, I worked really hard, and I wrote my book, Naturally Healing Autism, based on what I did to heal his symptoms. And homeopathy was definitely a big part of that. And I have had great success, and know many, many people who have as well. So I wanted to ask you to come on today so that you could share as a professional in the field with our parents so that they can help get a better understanding, because it is kind of a hard thing to grasp how it works. But all I can say is it does. I mean, if people saw my son today, he's 20, and he's just fabulous. I mean, all of those symptoms he used to have, oppositional defiance
Hmm.
disorder to an extreme, aggression, anxiety, depression, that's all
Right.
gone.
Those are
And
all
I
treatable with
was
homeopathy.
Yeah, yeah. So I really want to help people get their children better and show them the resources that exist to do that. So we really appreciate you coming on today. Again, your website
Is
is
www.healthyhomeopathy.com.
great. And this is Karen Thomas, and my website is naturallyhealingautism.com. So again, thank you very much for sharing
You're quite welcome.
your insight, your education, and your time with us this morning.
Okay.
All right,
Thank
thank
you.
you. Have a
Bye-bye.
great day.